So welcome everyone to our November webinar. We'll just wait a few minutes for everyone to join. And please, as you join, please introduce yourself in the chat, and we can find out who you are and where you're from particularly. If someone can type into the chat, oh, great, I can see that works. So hello, Laura, great to have you. I'm not sure where you're from, but it's good for you to be here. Welcome. Rika has joined from South Africa, someone from Suffolk in the UK. We've got an Iraqi nurse. Great to be here with you, Abbas. Professor Julia Downing is in Kenya today. We've got Sharon from the UK. Someone else from the UK, Kuwait, the Philippines, USA, Colorado, London, crossing all continents, Alberta, Canada, Latvia. It's really good to have you all. We've got some more people from Louise and Loretta from South Africa. Angela is here from Coventry. We'll just wait just a minute more and then we'll start the webinar. Someone from Ethiopia, the Philippines, Chile. Nadia from Chile, lovely to have you. Ireland, Canada, Poland. Great. I think people will continue joining, but we'll just start and get things going. We've got lots to get through today, so we'll start. In Indonesia. So good morning, good afternoon, and good evening, everyone, and welcome to today's webinar on pediatric touch therapy. We are delighted that you've been able to join us today. My name is Alex Daniels, and I am the Education Manager at the International Children's Palliative Network, and I welcome you to today's session, and I'll be chairing the session, and my colleague Julia Downing is with us too. So this webinar is part of our ongoing series on children's palliative care, which we run on the third Thursday of every month. And it's usually held from 1 to 2:30 UK time. This is the last webinar for 2023, as we'll be taking a break in December. So in a minute, we will hear from our facilitator for the session. And after this, we'll have a discussion. And we want to encourage all of you to ask questions, to make comments. So you can do that. You can ask questions or make comments through the chat or the Q&A. And we'll keep track on this for the discussion later. So we really want these webinars to be as practical and as helpful as possible. So please, we encourage you to ask questions on the related theme. So today, I'm especially delighted to welcome our guest, Tina Allen, and I'm going to hand over to Tina to introduce herself and to talk about this really important topic. So over to you, Tina. Great.
こんにちは。僕は国際リルキッズ協会の親善大使オーティス・バレンタインです。今日は世界中から集まってくださりありがとうございます。皆さんをお迎えできてとても嬉しいです。Hello, Namaste, Vanakkam, Hola, Bonjour, Salam, Taja Salam, Akam Naga, Habari, Xin Chao, Maite, Witam, Dobry Den, Ni Hao, and Kumusta。今日は学ぶだけでなく楽しみながら新しいつながりを作りましょう。そして学んだことを子どもたちやその家族と分かち合いましょう。皆さんに最新の情報をお届けします。楽しみにしていてください。では始めましょう。
Hello everyone, welcome. I'm so very glad that you're all here with us today, and I'm super excited to talk to you about pediatric touch therapy. It's one of my very favorite things to talk about and share all over the world, and I'm excited that we're going to be able to talk about that this afternoon or evening or morning, wherever you find yourself. Pediatric touch therapy is an absolutely wonderful, innovative approach to children's healthcare. And as we get started, I'd like to tell you a little bit more about myself ever so briefly, and then we'll jump into this really important topic. So I have been involved with pediatric healthcare, and namely in the use of this intervention for over 25 years, which time flies. One of the things that has been absolutely amazing is to see the growth and the different places that I've been able to implement our programs, not only in healthcare settings around the world, but also in lots of different different organizations. So when I'm giving this information this afternoon or this morning or this evening, wherever you happen to find yourself, I'm going to give you lots of ideas for all of you that are tuning in, how to use it, whether you are in one of the most amazing healthcare settings that has access to every kind of healthcare technology and medication, or for those of you that are working in other kind of settings where you don't have that similar access. This is why pediatric touch therapy is so amazing, in that we can use it in such a sustainable fashion in settings all over the world. One of the reasons that it's really important to me that we're looking at different kind of interventions is I have a motto that I live by. I believe that children are our greatest gifts and that they should be treated with extraordinary care. And that's why I use this intervention. It's another way that we as pediatric healthcare providers and families can elevate our pediatric healthcare toolkits with an intervention that is not only relatively easy to learn, but also easy to implement. And I am going to say that it is sustainable, and that's something that's important, especially when you are a healthcare provider and might not only be using this intervention under your scope of practice, but also in educating families. So many children that we're working with need the support of everyone around them, the people in their communities, the healthcare team, and also their parents. And so I'll be sharing lots of ideas for you of how you can implement this right away. But I think first it's important that we understand what is pediatric touch therapy. You might have heard of this before, or this could be the very first time you're hearing about this intervention. So first, it's an evidence-informed practice. And I mention this because that would be something that I often am asked. Is there scientific evidence to the use of pediatric touch therapy or these kind of tactile interventions? What is the evidence? And who is actually studying? So the cool thing, and sort of an interesting thing, there are research studies that are coming out all over the world that support this intervention. Studies that show many different benefits that I'll be sharing with you today as well. And the interesting part of it is this approach is non-invasive, which I love. So many different practices that we're using with our pediatric patients are relatively invasive, and rightfully so in some regard, because we are trying to minimize symptoms or help with their medical management of their care. But some of the treatments that we provide are rather invasive, and that's why I love this, because it's not an invasive therapy. It's innovative, even though it's old-fashioned at the same time. So let me explain that. When I educate around the world, I've been very lucky to learn from so many different practitioners and different cultures about how they've been using this kind of therapy as far as massage therapy with the children in their lives and their practices, but never thought about using it from a medical aspect. And that's where the innovative part comes in. For example, when I've taught in India and been using the practices there, I've been extremely excited to hear all about the use of baby massage, which has been practiced for thousands of years. But when we talk about children with medical or special healthcare needs, there hasn't been such a use of massage therapy, and that's what is really cool. This is a new idea of how we can take that evidence that we study in our different cultures and then implement the touch therapy with the evidence. So we're using more of an informed approach to our care. With pediatric touch therapy, the other thing that I think is so important, and it really is leading in this presentation, is it empowers children and it promotes autonomy. This is different as well with a lot of different kinds of care that we provide in different healthcare settings. Our children need care to help save lives, to minimize pain and discomfort, and to even addressing their diagnosis or other things that might be happening in the healthcare situation. But we need to, at the same time, help to promote autonomy for them so that they know that they can make an informed choice in their healthcare, that it's their body, and this is important, and it might sound simple in my first introducing it, but the idea of a child in a healthcare situation not being able to make any choices or not feeling empowered in any way is actually something that can cause more trauma. It can cause discomfort. It can even heighten pain. When our kids don't understand, when our children do not understand that they have control of something, when they're feeling out of control, their fear, their anxiety, and their pain is often heightened. With pediatric touch therapy, we're doing so many different things that can help empower children. When we're empowering children through touch therapy, we're looking at permission, choices, and child development. 3 very important components to this therapy. With permission, the important component here might be introducing the therapy. So this is something I do all the time. You can actually see in one of the images that we selected here, I'm educating this young boy on how he will receive touch therapy possibly, and also how he can use it. So here's something very cool to think about. With permission, we ask permission to touch, whether that is through directly asking. So we're thinking of informed consent. And so with my informed consent, I'm going to use appropriate language to explain what is touch therapy to the child, so they understand what it is. Sometimes they hear the word therapy, and when you hear therapy and you're a child that's received lots of therapy, it could be a little bit scary. And so I take the time to explain everything in language that they will understand, and then at the same time asking permission. The permission is asked of every single child, verbal, nonverbal, cognitive differences. We're asking in a way that they will understand so that they can think about the intervention and they can decide how to receive it, where to receive it. That little boy that I was educating and working with in that image is a little boy who wasn't sure what it was exactly, and rather than receive touch initially, he wanted to try it. And so if we look at that image again, what you're going to see is I'm showing him with the permission of his mom, that it's his mom that we're working with there, and with his mom's permission, not only are we asking and explaining it, but I'm demonstrating at the same time, and he's trying it out. And this is really cool. When you think of kids that have so many different kind of medical treatments done to them, this is something very unique and very interesting. But permission is a foundational building block upon which I stand with my therapy that I teach all over the world. Permission is very important. What you're going to find out, for those of you that are going to probably take something away from this presentation and possibly even implement it into your practice, permission is actually one of the most important components of pediatric touch therapy. If we do not ask permission, and we just introduce the intervention directly, the child might be confused. They could be scared. It could actually even cause more trauma, because it's like other types of treatments that are done to kids, not with children. And that's what sets us apart. We're asking to touch before we touch. If needed, we're using this kind of example where we're asking the children to try before we touch it, so they have that experience. And the cool thing here is children's tactile receptors are much more compact in their hands. So when this little boy is trying, he's not only going through the motions of actually kind of curious, what is this like? He's already receiving interventions right away. He's receiving that benefit of tactile stimulation just through applying techniques himself. We also want to think about the choices. So clearly the first one is Would you like to receive touch or not? That's pretty simple and pretty easy. So that would be a really simple way to do it. But we have other choices in mind. So we will ask about where they would like to receive touch, taking into consideration, of course, medical needs and any kind of contraindications and precautions. This is a big part of our practice. Safety is really important. So where can we touch so we don't disrupt medical lines if the child has any kind of medical equipment? Or where can we touch where the skin is maybe not as fragile? Or in some cases, we even have children that have significant sensory differences. So the idea of introducing touch, which many people find relaxing, to a child that has a lot of tactile aversion, they may be a little bit uncomfortable in this initially, or maybe they are tactile defensive, so they may be uncomfortable in that way as well. And so what we would like to do is think about how we can give them choices that are safe and easy. So first one would be about receiving touch. The second might be if we're able to use oil, for example. In some cases we don't have to use oil, so I will say that for all of you that are thinking about, what about allergies, or I don't have access to purchase oil. Oil is not required for pediatric touch therapy. I will tell you that straight away. Absolutely not required. We also often touch directly over the clothing. We may not even touch directly onto the skin. Some children would like to keep all clothing on all the time, and so if we do, we will just touch right on top of the clothing, which is very safe and very comfortable. So easy choices. If we have the ability to play music, maybe the child would like to listen to music. Wonderful. Some people like to listen to relaxing massage music. Some people like to listen to animal sounds or other kind of nature sounds. And then a lot of kids just like fun music. It could be kid music, it could be popular music. I mean, it could be, I'm in Japan right now, it could be J-pop or something like that. And you know, as long as they're happy, doesn't really matter. It doesn't have to be music that we think is appropriate for pediatric touch therapy. It can be something that the child enjoys, and that will be a choice. Even little simple things, maybe we're using tactile items. I often use in my practice little stimulation items like little textured toys or textured little balls. Maybe I have 2 different colored little textured toys. Let them choose whichever one. Those choices, simple choices, yes, but those choices create immense empowerment for children. In addition to choices, we are taking into consideration child development, of course. And so with child development, I'm not only thinking of the physical development, though that is a consideration. And this is a big question I get all the time. Isn't pediatric touch therapy the same as adult massage therapy? No, it's really different. And it's not just the idea that they're younger and smaller, although those are 2 considerations. Part of it is size. So there's physical development that we have to think about. Children are smaller and they're growing and changing. Their skin is much more porous. So if we are using oil, again, not required, but if we are using oil, we have to choose something that could be absorbed easily and readily into the bloodstream, and so that would be important to consider. The skin can also move more easily, it's a little bit more mobile. And the tactile receptors, the sensory receptors, are much more compact. So I mentioned just a moment ago that the hands are an area where they're very compact. An area where they're more spread out based on size of each person is the back. The back is a larger surface area. So when I'm asking permission, if I have an understanding from the healthcare team or from the parents that the child is a little bit more tactile defensive, I may, with permission, introduce touch to the back because that's an area where it might be received more easily, being that the sensory receptors are much more spread out. So I'm taking that into consideration. I'm also thinking about their growth. So how are their bones? Are they fusing yet? Are we still growing and developing? Are they a little bit more, they're not as ossified yet, so they're not as strong. There might be some pressure considerations I have to keep in mind. And then I also have to think about the muscle tissue. So the muscle tissue for children, generally speaking, and then I'll of course add something about our children that are undergoing medical care. Children, generally speaking, their muscle tissue is a little less dense. So I do have to think of pressure in relation to bones, but also in relation to the soft tissue. There is a tendency for some people, not all, and probably a bunch of you that are tuning in today wouldn't think this at all because I think you work with children. However, there is a tendency to believe that within the touch therapy community or massage therapy, whatever language you're considering, that it has to hurt to work. I hear it all the time from adults. Oh, I really like it when they take their elbow and they press it really strongly into my shoulder, into my back. We don't do that with kids, so please don't worry. This is not one of those types of therapies that people have a belief it has to hurt to work. That is not at all what we're doing. We're working slowly. We're working carefully. We're adapting pacing. We're adapting pressure so that it meets the needs of that unique individual. And then when we're thinking about all of these typical development concepts, we have to now think about kids that are possibly undergoing repetitive medical treatment or significant diagnosis, or of course in the case of children that are undergoing a palliative care situation or possibly even into a hospice situation, their body may change even more so due to not being as able to weight bear. Maybe some kids have to sit more often, possibly in a wheelchair or possibly in their own bed or a hospital bed. And so that affects their development significantly. That'll affect the bones, and it also affects the muscle tissue and even the fragility of the skin. So when I'm working with children that have a little bit more of a medical complexity, I have to not only take my regular considerations into play, but I also have to think about what's actively going on for this child right now. This can change so rapidly. Many of you know it changes all the time. So one day I might see a child and I can practice specific techniques that were safe on that particular day, and the child gave permission on that particular day. But I might go the very next day to see a child and all of a sudden they're not interested in receiving touch therapy. Or it could be that they're not able to receive the same techniques they were receiving before. I'll tell you, one of the funniest things, and I love this in my practice, when I go to the hospital, I might be asked to go in and see a child, and that means that everybody on the medical team said this child meets the criteria. They are safe for you to go and see them, or they've indicated where we should avoid or the new medication change or something of that nature. And the parents and guardians have also said, yes, you're welcome to see my child. This is fine, because we need some permissions to be in place. But then when I go in to see the child and I've gone through the whole process of informed consent, explaining the therapy, walking through all the pieces, giving choices, asking permission, the child tells me to take a hike. That might sound strange, but I kind of love it. They don't get to say no to too many things. And so when we're thinking of that from that developmental aspect, that goes back to the concept of empowerment and the autonomy. So when the child is able to tell me, please leave or come back later or something else, that I'm probably one of the few therapy providers that they're able to do that with. I know that some of you tuning in are saying, no, they can tell me the same thing. And I love that. I think that's great, because there are so many other times where they're just not able to do that. And that's one of the things that I think starts to bring the benefits higher, is when you're bringing in that piece of the puzzle. When we're thinking of the benefits, they are achieved at a higher level when the child is relaxed and receiving it better. And there are a number of different benefits. I'm going to go through some of them. Obviously, I would love to tell you all of the benefits of pediatric touch therapy, but we won't go through all of them today, but we'll definitely talk about some of them that I think are really important. The first piece I think that most people think of are the physical benefits. And that's really good, because you might be wondering, when is touch therapy indicated? Why would we use it in the first place? Are there some really important reasons? And what's the science behind it? So the first one that I'm going to talk to you about is pain. With pain, one of the things that we're noticing, not only in the evidence itself, so the published research that we're seeing, I participate myself with a number of colleagues in research as well, because I strongly feel that evidence is important. However, I also feel, as much as evidence is important, that we're adapting everything that we're doing for that individual. So there's a little bit of is it important based on a research paper, as well as what do I see in my real life practice? Let me talk to you about both. With pain, one of the things that I see both in the evidence, in the literature, as well as in my real life practice, is pain is often decreased or minimized. That's wonderful. None of us want to see anyone in pain, let alone a child. I actually even hear stories all the time from my colleagues that I've educated on the use of touch therapy. And this is anecdotal, this is just what they've told me, this has not been published yet. But I hear this all the time, that when the kids have access to request more pain medication, or to call for a nurse or someone to come and visit them because they're uncomfortable, when we've been using pediatric touch therapy, they don't call for pain medication as much. They're not asking for the nurse to come in as much. They're much more comfortable. And not just immediately after the intervention. It's a longer term approach, and it's really something that sits with them longer. So that benefit actually can last longer than immediately afterward. We also use it during interventions. Some of the kids that we're working with have to have different kind of medical interventions. The anxiety around that causes pain and discomfort. Just the concept of what will happen next, or maybe they're having a blood draw, or some kind of a shot, or something else that's a painful intervention being administered. The fact that we can use it in a component of a distraction mechanism. I know that sometimes I'm working with hospital play specialists or child life specialists, and that's one of the questions that I'm asked. Can we use this when we're collaborating with the rest of the healthcare team and a child has to undergo a painful intervention? Could we use this as an example, maybe on the left arm? The nurse or the doctor is doing an exam or going to have a blood draw. Could we by chance talk to them on the right side and maybe even gently provide a little comfort to their hand? Would that be beneficial, and does that help? And in my practice, I think it does. I see it all the time. The child looks and is talking to the person on the right. The provider is doing what they need to do on the left. And oftentimes the little child will say, can you let me know before they, draw the blood, or before they give me the shot? And it's already been done. They didn't even notice, which is really different compared to when the child is really scared and looking and worried. What's going to happen? Is this going to cause something to me, or will it hurt me, or that unknown component of it? So using it as a concept of the idea of decreasing pain with a distraction option is one, but also what takes place in the body. When we are receiving touch therapy, so many wonderful things happen, and not just for the receiver. And I should mention this because some of you might be thinking, as much as we want to support and work with the children, is there also any benefit for those of us that might be using it? And that could be us as healthcare providers. It also could be parents. Cool things happen in the body. And some are really hard to see, or maybe we don't have any way to measure, but we've done it with science. So we've done the measurement for you. You don't have to worry about that. One of the first ones is when we ask permission of someone. So somehow we know that they would like to receive a positive type of touch from us. So in my case, I might ask a child. The child is somehow, yes, giving me permission to touch. When I touch, and it's a nice, healthy, positive, nurturing type of touch, oxytocin goes up in the body of the receiver of that touch as well as the giver. Now this is important because oxytocin is a nurturing, feel-good, even bonding type of hormone that takes place in our body, and it elevates when we're receiving positive touch. The other cool thing that happens is it balances our cortisol level. So when we're thinking about stress and we're thinking about cortisols going up, think about the kids that you take care of when they're scared of certain kind of treatments. You can see in their eyes, you can see in their face that they're having stress, that they're having anxiety. But when they're receiving a positive touch with permission, the oxytocin is starting to go up for most people. I mean, obviously we can't measure it on everyone, but this is what the science says, the evidence says. Oxytocin starts to go up. When it's going up, it blocks the ability for cortisol to raise. And the way that that mechanism works is it blocks the ability for the cortisol to bind. So it can't elevate anymore. We need cortisol. We need oxytocin. We need these kinds of ideas in our body all the time. However, we need them in balance. It's also better to not have kids with such high levels of cortisol. We don't want them to feel stressed. We don't want them to have that kind of discomfort. So really important that we're thinking of not only the concept of pain, but how does it work? How does that person feel comfortable? That's where relaxation comes in. Relaxation is really important. We think of relaxation all the time. It correlates directly to touch therapy and massage. I think that often that's why many people who have stress, especially healthcare providers, we all have different kinds of stress. We may seek out ways that we might relax, and one of those ways that some people do that is through touch. It's going for a massage. It's having someone gently give you a hug. That feeling increases your relaxation response. When children are asked permission, when they start to relax, when they receive touch, it affects the whole body. It's not just one specific area. And that's something that's really unique to this. And another question I'm asked all the time, is there a specific place we have to touch to get this benefit for oxytocin to possibly go up for that person? Or is there a specific place we have to touch so that they will feel relaxed? There isn't. It's where they're receiving touch well. It's with that permission. It's with that back and forth communication that makes all the difference. When the children feel relaxed through receiving touch, they're more apt to allow you to even do a little bit more with our therapeutic approaches, and that's where symptom management comes in. There are different approaches we can use for different kinds of concerns. Some of our kids have fatigue. Some of the kids are really just feeling afraid or having some trauma response. And so the idea that we could use something to balance this healthcare experience so that they have more positive touch rather than only the possible scary or painful type of healthcare related touch. This is really important. But then we also have specific symptom management, not only location specific. It could be full body. So fatigue, I mentioned, yes. Anxiety, I've mentioned, of course. We want to increase relaxation because it helps. But then we also have children that experience nausea. And with nausea, we have specific techniques that we can use that will help to address or approach them when they're not really feeling like being touched at all. Well, we do have approaches for that. Or some of your children may have significant headaches or discomfort in that regard. There are techniques we can use that help to address headaches. Some of them are very simple for us to apply. Some of them could even be administered by children, which is amazing. So if you have that child, I've had plenty of kiddos that with oncology diagnosis that are possibly even having chemotherapy or other types of medications where they're feeling nauseous. And we use some techniques directly with them. We may also teach those kids when they're not ready to receive touch directly. Maybe they're afraid it will cause more of that nausea feeling. We can actually teach them so they can self-administer and use it from a self-care component. But there's not only these physical benefits, there are also emotional benefits. And this is something that is extremely important because with the emotional benefits, we're thinking of the full person, the full body. So connection. Connection is really important. It's not just the connection to us as a healthcare team with that pediatric patient, but it also could be the connection with their community. If you're working in more of a community-based program, it could also be the connection with their family. I haven't mentioned it except for just a little bit, but I do want to bring in the concept of the families for a moment. As much as I'm thinking and speaking to you as healthcare providers that will want to use this tool under your toolkit, I also want you to think about empowering families. So many times I enter the room of a child who I've been told may have a life-limited expectancy, maybe a palliative situation, maybe even in some cases a hospice type of situation. And I'm asked to go in and provide therapy under my scope of practice. And that's absolutely fine, and I welcome that opportunity. I'm grateful for that opportunity. But when I enter that room, I see a parent at the bedside who is scared, who is uncomfortable, who has fear around their child's diagnosis, who doesn't know how they can help. And when I enter the space, they look at me and they say, "I'm so glad that you're here. Please, can you help her feel better?" In that moment, I change my approach. Now, I already mentioned that under my scope, yes, I could provide the touch therapy directly, and I absolutely could. However, when I see that, that connection is broken in some way, because a parent at that moment does not feel empowered to provide their child with the comfort that they need, this is when I switch it. This is when I say to that parent, actually, I'm sorry. Sometimes I even tell, I don't know, a little white lie, I'm going to call a little fib we sometimes say. Oh no, I think you misunderstood why I was asked to come and see you. And then they look at me a little bit puzzled. And I say, no. The way this works is I'm actually going to teach you. And if you'd like, we can try together with your child. But I want to show you something that you can use. Now, there's a reason why I do that. One is I want them to get up and to work with me, because I know that they're with their child more than I am. When you see that parent sitting bedside, you know they are sitting there day and night, not leaving their child's side, but they don't know that they can touch them. I've had so many parents say to me, no one ever told me I could provide touch, that I could hold her hand, and I didn't want to hurt her. I didn't even want to go to the bedside and hold her hand because the nurse didn't say it was okay, which is wonderful. The parents have great respect for the healthcare team. And at the same time, the healthcare team doesn't realize that we have to remember to stop once in a while, make an observation, and even give permission back to parents to be an active healthcare provider for their own child. So yes, it's not exactly true when I say, nope, I think you misunderstood. You need to come and help me a little bit. But I do that because I want them to, because I want to empower them. And when you see the parent learn how to reconnect with their own child and to learn just simple techniques that they could use that will not cause any harm, it's much more powerful than if I were to provide the therapy. If I just think ahead, what if this happens to be eventually, possibly, an end-of-life circumstance? So many parents are grateful that they were the ones who helped their child feel more comfortable, that they were able to help them fall asleep, and that their child passed in a peaceful manner rather than extremely uncomfortable or in significant pain, or showing that kind of discomfort that makes a parent feel like, if I just had something else I could have done. And this is the something that the parents can do when they don't have another option. This is what increases not only that connection but provides comfort. And that's one of the coolest things. Super easy intervention, non-invasive, evidence-informed, provides significant comfort for children, even when pain medications don't work anymore. And there is literature on this, that we're seeing that certain therapies, especially some of our integrative therapies, like touch therapy, they provide such comfort even beyond the use of certain kind of pain medications. So for those of you that might be in programs that you have limitations in that regard, this is a very good tool for you. It provides significant comfort even when we cannot provide the medicines that some of our kids may need. They're not always readily available in every single country that we work in. I've been really lucky in that. I've traveled and taught all over the world, not only working in healthcare settings, but working in different developmental sectors, working in very remote places where there isn't a hospital nearby, where therapy providers maybe go to visit that area. When I was in the Philippines, just to give you an example, I hope that some of you are here from the Philippines. One of the islands that I went to, I understand that a therapist, an occupational therapist or physical therapist, goes to this island maybe once every 3 or 4 months. And that's the limitation that they have of receiving those kind of therapies. And so to be able to bring my team and to educate everyone in that area so they can continue to use the intervention long after our visit is powerful. And it really does provide comfort and connection. And then, of course, communication. Communication, if you think of it, as much as I'm having a little bit of verbal communication with you at the moment, communication, majority of it is non-verbal. Do you know the sense of touch is one of your very first fully formed senses and one of the last senses to leave you before passing? So we communicate so much non-verbally, and you communicate even more through touch. To do this kind of intervention or this kind of practice, you really just need education, your heart, and your hands. And that's what it communicates across the spectrum. It doesn't have to be a lot of talking. It has to be a good understanding that we're communicating with one another, and that you understand my intention of what I would like to pass to you when I touch with my hand. So it's something that's super easy to communicate in that regard, so that you're communicating that every single child matters. When we think of the psychological benefits, decreasing anxiety, which I've mentioned, but I have to mention it again. A lot of kids have a lot of anxiety, and it's not just anxiety around their current circumstance. It's not anxiety only what's going to happen next, but it's a lot of that fear of the unknown is what creates anxiety. And so here is something I use all the time with touch therapy, is when I introduce it and I ask permission and I explain what the intervention is and how it can be provided and all of the choices without overwhelming them. Of course, one thing that I'm always thinking of is that routine around the way we use the intervention helps to decrease anxiety. You know, kids love routine, even your most medically complex kids. So to give you an idea, one of the young men that I had an opportunity to work with, he's an adolescent, and he had a very significant diagnosis that caused him to be in a palliative care circumstance. One of the things that I made the observation of as he was getting closer, we believed at the time, to an end of life situation, his family really changed the way that they parented him. And so what that means is, rather than the same kind of rules and guidelines that they would always put around everything, they started to sort of loosen up those rules and guidelines. So everything was, oh, you can do what you want. Oh, you want to have, 4 ice cream cones today? That's okay, go ahead. You want to play your game unlimited length of time? That's okay, go ahead. And he would push the boundaries, but every time he'd push the boundaries, it was just the boundary was opening wider. And when I would speak to this young man, I could hear with what he was saying to me is he was really scared. And part of it was because the family was not in a place to tell him what was going on with his medical situation. But he was smarter than us. And that's something I haven't said, but I think you know it if you work with children. They are smarter than us. And so this young man had a concept that something was changing with his healthcare diagnosis, but nobody was telling him. And because of that, he was getting more and more anxiety. He seemed more worried, he seemed afraid, and he just kept pushing the boundaries and pushing the boundaries, and the door kept opening wider. And one of the things that really helped decrease his anxiety is when we had an open conversation with the healthcare team and the family, and then eventually the young man, and realized that we needed to, with the family's permission and the way that they felt comfortable, have a little bit more dialogue around what was happening with his healthcare so that he felt more involved. So he understood possible prognosis or possible choices and situations that helped to decrease his anxiety. So that conversation sometimes needs to happen, or that truthful piece with the kids is something that I advocate for all the time, is that we're honest with our patients. There are times when you say certain things, yes, and there are times that you make it more developmentally appropriate, and so that all makes sense. But we always want to be honest with the kids to our very best ability, so that that helps to decrease their anxiety. The physical aspect of what happens in that is the hands-on component. When we're thinking of those neurotransmitters and those hormones and those changes in the body, or even just that idea that maybe we're walking through the idea of doing some of the techniques and then you see the child is breathing better and you make mention of that. All of those things take place during touch therapy. And then depression. A lot of our kids do have depression. Sometimes it's not easy to see. Based on your background, you might have one concept of what depression looks like with some people, and some people, I suppose, think it's only someone who's really quiet or very, very isolated, or they seem sad, for lack of a better word, but that's not always what it looks like. With kids or even adults, it could look more aggressive or angry. And so paying attention to children and how they might be changing, if you're following their care for a long period of time, becomes really important. With depression, we actually have evidence to support that touch therapy does help alleviate symptoms of depression. And to think that children are depressed is something that you should be considering in your practice. It's something we don't talk about enough, and something that should be addressed. Even little kids, small children, can have signs of depression, and so understanding that it becomes important because we want to look at changes, physical, emotional, psychological changes, so that we can help to reduce those symptoms over time. It doesn't happen instantly, because this is a question I get all the time too. How many touch therapy sessions do we need to provide before we can the following benefit, whatever that is? Every person is different. The response time is different. Every child is unique and different. So knowing that, we adjust it. Yes, we read the evidence. If you read the science, it's going to say often, 15-minute intervals 3 times and on and on and on. But children are not research projects. Children are individuals. And so I want us to individualize it and recognize when they're responding well and they would like to receive more touch therapy, we might continue. When they're not responding well, they need to change, they need to stop, they need to break, we respect that too. And when you're monitoring it, monitoring the response in that regard, you will see a higher benefit, and often much more quickly. Now, because it's an evidence-informed practice or an evidence-based practice, I do work collaboratively with many different healthcare settings around the world. And I'm going to show you a little brief video of one of our programs, which is at the UCSF Benioff Children's Hospital. So that's University of California, San Francisco. And I want to show you this little piece so that you can get a little bit more of a full picture of what it looks like to utilize pediatric touch therapy in a medical setting. I started working with UCSF Benioff Children's Hospital a number of years ago when I was asked to help them develop a pediatric massage program. Their program is getting started right now in the oncology and hematology department, working with children who have cancer diagnoses.
My name is Lisa Purser. I'm the patient care manager of IP3, the Pediatric Pain and Palliative Care Program at UCSF Benioff Children's Hospital. One of the main things that we provide that patients and families love is our massage therapy program. We offer massage therapy 2.5 days a week in 4-hour blocks. We also provide massage therapy to our parents in the Center for Families, so they have a little window where they can go and receive massages as well.
The very first time that I was invited was to do an educational program so that their staff and the outside massage therapists that would be coming in would know the best way to safely and effectively treat children using massage therapy.
I was looking for some kind of modeling, so Tina provided us with a modeling behavior.
To have a treatment that is non-invasive, that is non-hurtful, changes the child's perspective about being in a hospital setting and allows them to see, like, okay, this is temporary, it's not all bad, and Tina really sheds this light to a population that really needs it.
I've taken some alternative medicine classes during nursing school, so I'm always interested in doing this, and so the fact that the hospital supports nurses doing it is why I figured it's a time and get trained and get certified, that way it's official.
Part of what she's given us is these ways to work in small amounts of time, 5 minutes here and there while we're giving a bath. Every patient gets a bath every day. If we can massage them for 5 minutes while we're giving the bath, well, she has shown and it's proven that it will help them with their relaxation hormones. The cortisol will decrease, which will definitely in the future allow them to be more relaxed and more comfortable, more trusting, live a more joyful life.
It's a nice way of bringing comfort without needles or meds and scary things. It's just, a nice person coming in and bringing some comfort.
Experiencing it myself, it's real. I mean, it's the touch. It really makes a difference.
Now we have begun this program, and it's growing every year, where we're seeing more staff members become involved and other departments become interested. So it's starting to expand from one unit, and soon it will be hospital-wide, that they will be able to provide massage therapy to the patients, whether they're infants in the neonatal intensive care unit, to pediatric department of the PICU, the pediatric intensive care unit, even into the oncology arena, which is where we're working now. And seeing that grow is not only only amazing for the parents and the patients, but also for the staff to have one more tool in their toolkit to bring comfort to these kids.
We've been very thankful and grateful for Tina for really collaborating with us and dedicating time to help us grow our program. She's been extremely gracious and led us in the right direction and helped us develop our policies, procedures, and guidelines around massage therapy and acupuncture as well.
She is not only a wealth of knowledge, but she's an amazing person. She realizes that there's a population of clients that have not been touched, of clients of all around the world that are just not getting the care that they need.
When a hospital initially contacts me and we start discussing how we'll develop a pediatric massage program, there are a number of different steps we have to go through because we want to make sure the program is streamlined and turnkey and it can run long beyond my involvement. We want to make sure that it's something that the hospital knows how to utilize really well. So when I go in, I typically meet with whoever the key players are, whether it be a certain team or administration, and we talk about their pediatric massage program, how I've designed them for multiple institutions, and how we want to integrate, what units we want to start in, and then we start developing the program. So I go through and I help them. I write policies, procedures, program guidelines, even job description to help them find the perfect candidates that are properly educated and licensed to work in their program. Then we go in and set up time to educate everyone who's involved with it. So administration knows who should be working in the program. So the doctors and the nurses know how to order or send the patients, refer them for the massage. The therapists, if they're coming in from the outside, know who to check in with, how to read the electronic medical records, how to chart and what they're looking for, so they can really develop a proper treatment plan. And then, of course, how to go in and treat the patients. We have to think about all the different questions, whether the effectiveness of the program is part of it, what the budget will look like, what the costs look like, and any kind of liability issues, and just to make sure it's streamlined. So it's something I do from A to Z all the way through and make sure that the program is going to work and it's going to last and it's going to be effective. So of course, one of the things that we have to consider too, when we're thinking of practices, there are a lot of challenges and considerations to using this idea here. And so you see a picture at the UCSF Benioff of one program. Now, one of the things that I do for every single institution or hospital or organization that I'm working with, I do have to think about program development and implementation. And so we develop the program in a way that works with the unique individuals that that community serves or that healthcare institution serves. So not every single program looks identical to one another. There are different things that I need to do, from helping design the protocols that will work best with those populations, or maybe they need assistance in program development from the aspect of the guidelines or consenting procedures. When we talk about who will give consent, whether it's a physician, is it a nurse, is it the parents, it depends on what kind of community or healthcare based program we might be working in. And so I help design all of those things from A to Z because I want to make sure that whatever type of program I'm helping to establish, it'll be with my support, of course, and that I can continue to support it, but that it can be working long after I've developed such a program, because I want that institution or that organization to be able to continue and grow. It's like planting seeds, and then you want them to grow so that you have a sustainable program that can then be replicated. There is a cultural sensitivity component to this. I mentioned earlier some of the different countries that I worked in. I only mentioned a couple. I actually work in many different countries all around the world, and everywhere that I work, I'm not a person that comes in to say, here's a program that we use in a certain way, and I'm just going to tell you how to do that program. I actually want to learn about your culture. I want to learn about any sensitivities to touch, whether it's specific body areas that we do not normally touch because of certain kind of cultural or spiritual beliefs. I'd like to honor those and recognize and respect them. And so we can adapt our programs to meet those cultural sensitivities, or family beliefs. Some families have different belief systems, and that's another time that we want to recognize those, honor them, respect them, and adapt the program. So our techniques can be adapted to meet those specific needs so they can be implemented in settings all around the world, and at the same time appropriate for children of many different cultural backgrounds, religious backgrounds, spiritual backgrounds, or from families that have different beliefs altogether. I adapt it because I believe this program and this type of therapy is appropriate for every single child, and they all benefit from it. The important piece then we have to consider is what is the training and what are the competencies for healthcare providers. So in that piece of video you just saw, you saw where I'm providing education in the hospital, helping the healthcare team to learn more about the foundational components of using touch therapy, the evidence, the benefits, the indications, the contraindications, all of the pieces of the puzzle, so that when they have that information, they can then make more of an informed choice of how they can not only provide this therapy in their institutions, but when to adapt it, how to adapt it. I will tell you, I've not had very many children that are not medically appropriate for touch therapy. It's extremely rare that we're not able to provide touch. And so I should show you something to elaborate upon that. One of the techniques we use, which is relatively simple, I call it nurturing touch. And so it's after asking permission, and you know the child has given permission to be touched. It might be as simple as taking my hand after I've warmed them up and asked permission, maybe with oil, maybe with not. Remember, we don't necessarily need it. But then taking my hand with permission and gently resting my hand on the body area where the child is allowing, where that's appropriate for them. Or in the case of maybe I'm showing a parent first so the child can see through a demonstration or possibly education. This little technique that I'm showing you, as soon as I show it to most people, at first they think, that seems rather simple. Could it have a big benefit? What's the purpose? So this touch in itself communicates that that child matters, that they're really important. It also communicates that they're safe, that they can trust you. You're starting to establish and build rapport, and that little bit of touch, when it's given with permission, that positive touch, even this right here can help to bring up oxytocin, can help to decrease cortisol. And when the child is more relaxed, then we might, if the child's body is appropriate based on their medical circumstances, we might be able to do more than that. But I don't want anyone who's tuning in today to think this isn't beneficial. This is hugely beneficial. Oftentimes when I'm referred to work with a client or a patient, they might be a really medically complex kid. And when I go and talk to the healthcare team to ask all about any kind of contraindications and precautions, they look at me a little bit puzzled and say, I don't think you can do anything with this child. So then my next question, my follow-up question always is it okay to provide touch? Can the child be touched? Well, sure, we touch them all the time when we're doing bed bath, when we're helping with daily care, when we're administering medications. So they're allowed to be touched. That's safe and that's okay. Yes, that's safe and that's okay. Now I can do something. This touch is different than medical touch because of the idea behind it. It's not a technique, it's the concept, it's the intention behind the touch. That's what really communicates and makes a difference. And that's why I show you something that you can easily, simply use in your practice, because I really truly believe that together all of us really can improve pediatric healthcare. These little interventions, these really important beneficial interventions that all of us can add to our toolkits really do make a difference. And so even if you leave this presentation today and you take the concept away of really ask permission, ensure that it's medically safe, and just touch nicely. Just touch in a positive way. That will make a difference. It will balance that fear around medical touch. It'll balance the pain that they might have experienced. It will help so that we don't have as many kids traumatized, as many families feeling uncomfortable as we see when we're only using certain kinds of uncomfortable medical treatments. So this positive touch, I really want all of us to start adding that into our practices, because we then really can improve pediatric healthcare. So I definitely want to take a moment and thank all of you that are tuning in. And of course, the ICPCN, who does so very much to support this wonderful work in the community. This work is so important that all of us are collaborating. We're talking with one another. We're learning the wonderful things that each and every one of us are doing, and then we're bringing them into our practices. So I feel very, very grateful to have had the opportunity to be with you today. I understand there may be some questions, so I'm going to check in with Alex and see if I can help and answer some questions.
Thank you, Tina, and thank you so much for an excellent presentation. You know, it's a subject, you know, that is very, very close to my heart, and it's such a delight that you've been able to share so generously and, you know, given us a lot to think about, I think, as healthcare workers. You know, the thing that really stands out for me is the whole issue around permissioning, and particularly with hospitalized kids, where so many times we're touching kids quite invasively. You know, the issue of asking permission is for me also twofold in a society where there's just so much inappropriate touch. You know, there's a lot of that happening, and kids having control over who touches them, how they are touched, I think is a life skill for many of us. So that is a really important aspect and component to what you shared, and the issue of giving them the choice. And that kid who said no, I mean, that's yay, you know, especially having that kind of power, you know, to be able to say no. You know, as many adults, we struggle to say no, but that's another subject. So this has really been very helpful, and there are loads of questions in the chat. A lot of appreciation for your sharing. One of the questions that comes from Nadia is, could the techniques that are used in children be used in adults as well with effect? Thinking about gentle touch. Yes, I'm interested to hear you comment on applying these techniques with adults. In a sense, you're doing that already. I like the component of drawing in and empowering families, but what has your experience been with working with adults and sharing this technique with them?
That's a great question, Nadia. Thank you so much. And I love that question, because oftentimes when I'm giving a presentation or an educational course, and of course, initially my focus is pediatrics. And so when people start hearing the ideas and the concepts, this question often comes up. Wait a minute, could we use it with other people? And so I haven't elaborated that much on my background, but I will add, and then I'll add some more pieces too. I also have worked at both ends of the life spectrum. So I've worked from the very micro premature baby group all the way in through geriatrics. And so even some of the techniques that I use with the most medically fragile or the most delicate of pediatric populations, being that those techniques are safe enough and gentle enough, yes, they are safe enough and gentle enough for us to use across the life spectrum. Some techniques that we use with healthy, typically developing adults might be a little bit too aggressive for some of our pediatric patients, but it's opposite. When we think of these techniques being gentle and what is the effect, we do see it with our adult populations as well. So absolutely, you could use the things that I share with all across your life spectrum. It would be gentle enough for those folks. And you know, interestingly, working in the elder population, and I've had the opportunity to work in palliative care with our elder population as well, I often end up teaching adult children how to provide touch therapy for their mother or father who might be having a little bit of a life issue at that time, or possibly at end of life. And it's quite empowering as well, and the same concepts apply. It's with permission, and we teach them, and ever so gently they learn. But I see sort of a similar kind of benefit in using it. So I appreciate that you've thought of that, and absolutely, the short answer to your question is yes, you can do that as well.
And then linked to that question is, how do you challenge professionals or parents who don't believe in the benefits of touch therapy?
Oh, that's a wonderful question too, because when I explain it, some of the times, of course, they're thinking, well, I don't read scientific papers, and we're not doing a test right now. So how do you know? So part of what I always ask people to do is, one, explain their question to me, like where is their doubt, because it could be a lot of different places. So that would be one. If that's a struggle for them, then I do explain the benefits, and I do reinforce it with science. Even if they tell me I don't really read science or anything else, I do show them through that application as well. So reinforcing it with the evidence, but then with permission, if it's appropriate, and this is a cultural piece, or this might be in that person's own belief system, I often ask if I can touch their hand. And the reason why I say the hand, now again, take it with a grain of salt. If that's a safe area for the person, it could be somewhere else, or we could also do something different. But I often ask if I can touch their hand. And the reason I do that is the hand, typically for most people, is a little less vulnerable than other areas of the body. It's also an area that they can withdraw. And the same applies with the kids, so just keep this in mind. They could withdraw that area if they weren't comfortable for some reason. But when I warm my hands and I ask if I can touch their hand, I ask that person to give me a little bit of feedback of how does that feel. And the funny thing is, and I'm sure it doesn't happen every single time, but it happens so often, they say, oh, I can see how that would feel relaxing, or I could see how that would make the person a little bit more comfortable. Sometimes with touch, you have to demonstrate to show them. And the same is true with healthcare providers. I know that I'm speaking to healthcare providers today. However, I can tell you, I've had tons of folks in the healthcare world that read scientific papers all day long, but have never been touched in a positive way. And so the concept of referring a patient to receive touch therapy is extremely foreign even to that person. So I often ask if I can touch their hand and give them that introduction to touch. And I do think that that helps. People sometimes have to feel it to believe it.
Absolutely. And, you know, I can share on a personal note, when we first met you, Tina, and you were connecting with us via Zoom, and, you know, we were a group of 40 professionals, healthcare professionals in a room, and we had to work on each other. It was revolutionary. I mean, we had that experience in the room with people who had never been touched. And it was amazing. You know, the proof is in the pudding, I guess. So you need to experience it yourself in order to be able to, you know, then really be able to believe it and then pass that on to children and work with children. There's another question here about ethical considerations from Dorcas. And she wants to know, are there any ethical considerations in using touch therapy?
Absolutely, and that's a great question, because as providers, we want to know that the evidence informs our practice and what we're using is safe and appropriate, but at the same time, is it ethically something we can do? So the component of asking permission, I think, really helps us here, because we're working with someone who we need to ensure that they're comfortable with receiving touch. And so let me give a little bit of more reinforcement on that concept, because I know that some of you are working with children that may not be as verbal as another child. So when I say ask permission, some of you are tuning in and thinking, I work with kids that are not going to say yes and no, or it's going to be a little bit more confusing. It's like nonverbal type of communication. So what I'm looking for, I'm looking at expression in the face to make sure that the person looks comfortable. I'm watching breathing, and I'm looking at, are they breathing, especially with the child, are they breathing up in the chest, or are they breathing in the belly? The belly is more relaxed breathing. So I'm observing this concept. So how are they breathing when I ask? How are they breathing when I start to touch, if that's appropriate for that person? If they happen to be on monitors, I'm also looking at monitors and getting the readings. What is a safe zone for this person? What's the baseline as we start? What does it look like during the session? What does it look post? So I'm keeping an eye on all of these things, because one of the pieces ethically that we have to consider is, does the child want to receive touch, and how did you know? And how did you know that they were responding well? How did you know that they wanted you to continue? And I think that's a consideration that comes up very often, is that piece. And then, of course, making sure that we have permission from the healthcare team, and then the guardians if they're present, or depending on where you're working. But those considerations, I think, are important. And it's something that can be questioned, and people might ask about that. And so having some ways that you're very sure of yourself, that you are aware of the child's life likes and dislikes, and that they're actually consenting become important. Then you're not doing this intervention without having that reciprocal communication taking place. But you can do that also with very profoundly involved children. I've had the opportunity to work with children that are considered blind and deaf and cognitively having some differences, and the question comes up, how did you know that they wanted you to start, and how did you know that they wanted you to continue? And that's with all of those ideas of looking at that nonverbal communication. So you always want to ensure all the time, and if you're in the moment providing touch and that question comes up for you, I think they want to take a break, then you take a break. And when you recognize that and you do that, you are practicing in a very ethical fashion.
Right. Tatiana has a really interesting question. You've spoken about using touch therapy as a complementary therapy, as helping with pain and other symptom management. She wants to know, do you use touch therapy as a complementary response to a specific symptom like pain or anxiety? Or can it be incorporated to treatment plan as a separate element of supportive care from the moment of diagnosis of incurable illness? And she's also adding, have you ever had a negative experience with using touch therapy?
Wow, great questions. I love it. This audience is amazing. These are really good questions. So first, let's talk about, let me go to the end. Let's talk about any negative experience. The example I gave during the session of the little one telling me to sort of take a hike. Some people could see that as negative, and I don't. And I'm glad, Alex, you mentioned you don't either. I think that that's important. Negative response, I haven't had any negative response except to say that maybe I have to adjust something I've done. I've made a mistake. I think many people have, and I try to be very culturally respectful, and I try to honor and recognize children's beliefs and families' beliefs, but there's always a case where you weren't informed correctly before you've entered a space, and you might have said something that wasn't appropriate. But I find when you apologize and you recognize that you've made that mistake. So there has been that, but it's not touch therapy related per se, other than that communication component. But yes, now benefits. There are tons of benefits. I, of course, have such a short window to give you a quick snapshot. Sometimes it's the idea of full body relaxation, because what we find with that is it helps decrease anxiety overall, and it helps with depression. It helps some of those things that I was talking about with mood. It could help in the case if they have pain. Some kids fall asleep during touch therapy. Of course, we stop. We no longer have permission, but the cool thing about that is they often sleep quicker, deeper, and longer. I've worked with so many kids, I just cannot get comfortable. And being able to have some kind of intervention that works in that capacity is good. So it could be something that we have a symptom management concept where someone says this child is even constipation. I haven't brought that up, but it's really important. A lot of your kids have significant constipation for a variety of reasons, and we have techniques that we use in a touch therapy protocol that help with increasing motility. So it might be that someone asks me to work with a child for a specific symptom. It could just be part of their regular treatment plan on a regular basis. You can do both. It just depends on what your program looks like and how you want to use it in your scope of practice.
Right. We've had quite a few questions about training, and I'm delighted that this has come up. But the questions about training, Nadia wants to know where could she get trained? She's from Ireland. If you could recommend any place that you know of or could facilitate a trustworthy course. And someone else wants to know, are there any online resources available? So I'm going to answer the online one, and I'll leave you to anything you'd like to add. We're delighted at ICPCN that we run an e-learning program where we currently offer 10 short children's palliative care courses in 14 languages. And the latest course that we've earmarked is one that Tina and a team will design on touch therapy. So please look out for that coming up soon. That will be a very exciting course. Anything else you'd like to add to that, Tina?
Absolutely. So yes, thank you for that. I am excited about that. I'm thankful that we've discussed that collaboration, and I think that'll be a really good opportunity for those of you all over the world that want to tune in for some e-learning, and we're working on that now actively, and I'm sure as soon as we have a release date that ICPCN will share it with all of you. The other piece is through the Little Kids Foundation, which I am the founder and director of the organization. We offer certification and education not only in person all around the world, but also we have a full comprehensive certification courses opportunity in our virtual learning lab through littlekids.org, and you're very welcome to go there and visit and have a look. We have tons of resources as well that are complementary resources for your learning. There are a lot of ebooks and there's videos and lots of different kinds of things. We'd be happy for you to go and check out the website and you can see that. For the remainder of this year and the first quarter of next year, all of our in-person courses are taking place in Japan. So if you would like to come to Japan, or if you're already in Japan, I would love to welcome you here and have you come to a course in person. But you know, just as Alex mentioned before, when we first met, it was through a course I was doing with St. Jude Children's Hospital, and I tuned in via Zoom, and I had some of my team there, but we did that nice collaboration of a little bit of virtual and then the in-person experiential, and we offer that as well. And so and we do have, and I can add just, and I would add this because of being asked, we have a number of certification programs. We offer 20 different certification programs that are population or developmental specific. So I mentioned that I do have background with working with the neonatal population, so we have programming in that regard with the infants and the neonates. There's programming with pediatric specific touch therapy, oncology, palliative care, autism and sensory differences, lots of different kinds of populations that I work with on a consistent basis. And I am very involved in all of the development of our comprehensive courses. And so something that's very interesting, and I mentioned it early on, I've been doing this for over 25 years, and many of the people that I train still stay in touch with me and have interesting cases that they're presented with that are something unique or very unusual populations that they haven't even worked with before, and they have questions. And so I do make myself very available to try to support everybody out in the world to try to use these therapies. The other piece that we do that I haven't mentioned yet as part of our programming, so of course, is the hospital-based development that you saw a small snapshot of. We do offer the education and certification programming as well. And then we do have another program which is called ITEP. ITEP is the International Therapeutic Exchange Program. And for this program, I typically, with my group, select about 30 to 40 qualified healthcare ambassadors who will join me on a journey to another country and will provide complimentary healthcare and education in those countries. And we've done quite a few outreach programs in the Philippines, in Vietnam, and Thailand, and other places as well, India. And so if some of you are interested in those kind of opportunities as well, if you would like to jump in on our website, you can put your information there and be part of our newsletter where we'll keep you up to date with not only complimentary educational resources, but events and different things that you might want to be part of in the future. We're really always happy to share information as much as we can to support families and children.
I feel like we have so much to get through and so little time. But someone's asking about what benefits have you experienced with children who have nonverbal autism sensory needs. And I know you've done a lot of work in this area, so it'd be great for you to share.
Oh, there's loads, Alex. You're right. And if we only had a whole other session just on this, wouldn't that be great, you know? So we will one day, maybe. Let's all think about that. I'll give you a snapshot, and then I will invite you to the website. Please come and visit it, because I do write articles and I put up ebooks and all kind of cool things with this in mind. So yes, with autism and sensory populations, there's been lots of cool things. One is, I think one of the things we hear about, you know, 56 to 83% of children with autism have sleeping issues. And so that's one of the things that's been a really good benefit that we see, is being able to utilize touch in a way that helps address some of those issues. And I will back up to say, one of the most common things that I hear from people that are not as familiar, I hear people say all the time, children with autism do not like to be touched. That is not true. It is not true. It's how and when, and did you adapt it, and did you ask permission, and did you give time for transitions? Did you think about that piece? There's all of those pieces that go into what we do. So it's a lot about approach, and it's a lot about finding a texture that works well for that person, and it might be a routine. I work a lot with kids that have OCD and they have ADD and other kinds of things, and so using a routine that helps introduce a touch really well. I will tell you, I've had some pretty amazing benefits that happen that are far and beyond even addressing muscle tone issues or GI function, GI issues, or that wonderful tiptoe walking, which we see with so many kids that we need to fix. If you see that, we have to correct that because they're going to have lifelong issues if we don't. I've had really amazing things happen. Like one time I was working with a mother and her little girl, and I was told ahead of time that she's nonverbal, and I just always take that as a sort of little grain of salt, put it in the back of the mind, and go and do my work. And when I was working with this little one, she at some point sort of moved toward a toy, and she was sort of done with the therapy at that moment, and that's fine with me. I'm chatting with mom, and all of a sudden this little girl to the side starts yelling, "More, more, more." And I turn and I look at the time, and I look at the mom, and I say, we've got more time. Would it be okay if we do more? And the mom just started to cry. And I didn't know why. And she said, she's never spoken before. Those are actually the first words I've ever heard her say. And so then I said, well, can we do more then? Just, let's try. And we did more. And, to this day, I'll tell you, I'm in touch with that family. The mother's become more comfortable using touch therapy. She's been using it. The little girl is grasping more language, which is amazing. And I know your follow-up question is going to be, okay, what was the protocol? Where did you touch? Where's the button? I don't know. There isn't a button. We just did something that day unlocked the voice that she already had inside of her. And so I've had lots of really amazing physical benefits take place that I see, emotional benefits take place, and then the really important one is always that connection with the parents. I hear from parents all the time, I just don't feel connected with this child. My other child likes to receive hugs or lets me hold their hand, but this child doesn't. And I don't know how to bond with them. I don't know how to communicate with them. And that's something I've seen unlock through the use of touch therapy. And to me, that's probably one of the most powerful benefits.
I'm aware that we've only got a few minutes left, Tina, and we've got lots of questions. So apologies up front if I don't get to all the questions. I have dropped Little Kids, the website, into the chat, so please look at that. A question about what do you do if the parent or guardian disagrees, but the child agrees, or vice versa? And then another question about religion and culture mingled into this touch therapy approach. So what do you do? How do you explain it to guardians and healthcare professionals if that is their concern?
Great. So the first part of it is, let's say, for example, in the case of the guardian doesn't agree, but the child does. This is the child's therapy. It's tough. I don't want to upset families. I want to respect families, and I want to work together with families. But, here's a quick example. I might go in to see a child. The parent actually in this case might think it's really great for the child. They've heard about it. They want to try it. They understand it. The child's not ready yet. They need a little bit more time. So sometimes I'll have parents really insisting, nope, sit still, lay here, let's get ready. The child doesn't want to. Well, the child's in charge. So I do have to very professionally, delicately, kindly address the parent and remind them it is the child's session, and keep in mind that the example of if you make the child receive it, it might cause more stress. I use that same conversation with physicians. I have physicians all the time that order massage. They write the order for the massage for the child. I go to see the child, they tell me to take a hike or please come back later or whatever language they use, and then I'll come out and the doctor will ask me, why are you not in there giving touch therapy? I ordered that, let's do it. Well, I have to explain to them why it doesn't work. It doesn't work. And I can back that up with science. It doesn't work if I hold you down and tell you to relax. It doesn't work. And I give that example all the time. So there are two different kind of tough love conversations that I have with different folks, but I always really have to remember this is the child's body. This is their session. If we want to have the highest benefits, the child has to be in control. We can direct the session. We can guide the session. We can inform them and educate them, but they're in control of it. So sometimes you are going to find yourself in these tough situations, but you navigate them. Keep in mind the child is in control. I think that helps. The other piece of that with the family belief and the cultural belief. I always try to my very best ability. I would never say that I understand every single culture, every single spiritual or religious belief system. I don't. And I'm constantly learning and I'm constantly growing, and I think we're all doing that. And I think if you're open to that, that's important and that helps. And so asking questions to the family directly rather than guessing if you don't know, I think really helps. So I might give an example. Maybe in a certain culture or a religious belief system, touching the head, for example, may not be perfect they may not be a perfect fit for that group. But this child suffers from significant headaches, even migraines. They're having them often. And it doesn't mean I have to provide treatment in this area, but it might be a good place to do so. If I explain why I'd like to offer a touch in that area without overstepping, without saying I'm going to do it, just offering that this could be an option, oftentimes parents will listen to you. And they might say, no, in our culture we don't touch there. And I can say, that's fine, and I don't have to do that. I can also treat in a different area. Like, this is a great spot right here, for example, for headaches or decreasing anxiety. So I might show something like that. But if I introduce it from a professional capacity, why I want to do what I want to do, I think that's better received. So being clear, being honest, taking time to explain, I think really does make a difference.
Great. I'm very sorry we have to leave it here. There's this wonderful resource that you gave us, and this book, which you probably can't see, but a wonderful book all about massage for children that Tina wrote. And in that book, you use a lot of stories and rhymes and music to engage children and I guess to build relationships with children. But I really liked what one of the nurses said right in the beginning and reinforced those opportunities, and within our day as healthcare professionals, there are so many opportunities for engagement with children, within our really busy schedules, just integrating that little bit of extra time when you're giving someone a bed bath or you're doing a procedure. I really would like to encourage healthcare professionals to seize those opportunities and to learn more about it. But thank you so much, Tina. This has been great. A lot of people in the audience really grateful for your sharing and appreciative of your sharing. We're going to have to move on and close in a minute. I just want to say many of you have asked about the attendance and whether you will get a certificate. Sorry, I just want to show you that. I didn't show you in the beginning that many people have asked about the recordings, and the recording of this and all other webinars will be up on the ICPCN website. Maybe not today, but in the next couple of days. We had Tina, and also to remind that if you've attended 2/3 of this webinar, you will receive a certificate of attendance. And that will also be out in the next couple of days. So please look out for that. And to say to you that if you're not yet a member of ICPCN, please do join us. And this is the QR code to join our session, to join the organization as a member. Membership is free, and you will have access to a whole lot of resources and a newsletter that comes out regularly. So sorry about rushing you through that, but just really to say to you, this has been such an important webinar for us. It is the last webinar of this year, and it's really a great way to end the year. We want to remind everybody who has been on the call to complete the evaluation. And once you've completed the evaluation, then you will get your certificate of attendance. So these are links to our e-learning site and also the ICPCN website. But thank you again. And also, in addition to the recording of this webinar, we will also put resources that you'll pass on to us on our website, and we can share more freely. But I'd encourage you to have a look at the Little Kids website. So thank you once more to you, Tina, and also to your assistant.
Yes, I do have a lovely assistant in the background, and you may have seen him at the very beginning during your welcome video. And Alex, is it all right if he pops in and says hello?
Hello.
Hi. Here. Hi, this is yeah, he has grown since I've seen you last. This is Otis Valentine, my young man here, and he's quite a whiz with the technology. So I'm really lucky that he wants to use that education and help his mom out. So he made it possible for me to show you all the lovely video and everything today. So couldn't do it without this guy here.
Thank you very much, Otis, and thank you for staying up so late at night. I know it's nearly midnight in Japan, so much appreciation for staying with us, and we'll stay in touch.
Our pleasure. Thank you so very much for the opportunity and all of the amazing resources that the ICPCN provides. I really appreciate the opportunity to be able to share with all of you, and Alex and Julie. I'm very grateful for your invitation, and I hope that this has been helpful for so many of you turning in today.
I'm sure it has been. And Julia is in Kenya and has got erratic internet, so I'm not sure if she's still with us. But thank you to everyone who has joined today. And we'll see you soon. We won't have a webinar in December, but we will keep in touch and let you know when our next one will be. Thank you so much and goodbye. Keep well. Bye-bye.
Hi, my name's Otis. And I'm here to tell you that I feel great. Why? Because my mom just gave me a massage. You might be wondering, why would a kid need a massage? Well, lots of reasons. It encourages our growth and development. It enhances our body image and self-esteem. It helps with bonding and boundaries. And even helps with our anxiety and stress. Because let's be honest, kids get stressed too. Because we're still growing, it's important to know how massage affects our skin, muscles, bones, brains, and nervous systems. And that's why it's important to read this Modern Day Guide to Massage for Children. It's full of evidence-based, safe, and simple information about kids massage. I blew me so good.